Sound Off. Horry and Georgetown counties, we welcome you back to Sound Off. Again, Sound Off is heard weekly on your favorite radio station. It's always our goal at Sound Off to deal with topics that are relevant to you, the community, and always relevant to our young people. Again, we'd like to say good morning to Avant Auto Repair, located at 3411 Kates Bay Highway, a proud supporter of Sound Off. Sylvester Avant Jr., better known as Sly. Sly does business with integrity. And again, Sound Off, at the Sound Off crew, we'd like to say thank you for believing in what we do here at Sound Off. October is Breast Cancer Awareness Month, and that's why we're really honored to have two phenomenal women. I mean that with everything in me. I tell you what, Ty Grissett and Jamie Lewis, y'all are somebody. I just want you to know that. Sound Off crew, can we give it up for Ty Grissett and Jamie Lewis?
I am.
Ty is the Horry County Susan G. Komen Foundation rep. She's also an RN, and our friend Jamie Lewis. We celebrate you. Jamie Lewis is a breast cancer survivor. Y'all, come on. Yes. You know, I tell you what, that I would, if I could cheer, you can see my expression, yes. You know, and Ty said in the first segment, when you hear that dreadful word, it does not mean it's an automatic death sentence. And so before we move on, I'd like for the Sound Off crew, would you like to introduce yourselves at this time?
Good morning and howdy do. This is Raekwon.
Good morning, I'm Abrielle.
Good morning, this is Asia.
And again, good morning to Ty and Jamie.
Good morning.
So honored that you took time out of your very busy schedule to come and empower Horry and Georgetown counties, and not necessarily Georgetown and Horry County, but we're talking about iHeartRadio and people listening. You know what? The atmosphere in this room is gonna be changed because now we're gonna talk to a breast cancer survivor. Jamie, I tell you, I celebrate you, and I'm so excited. I know the journey has not been easy, but I want for you to, at this time, to share a little bit about your journey and how now you are a survivor. But when you heard that dreadful word, just take us through that and how you found out you actually had breast cancer.
Okay. Good morning, Horry County, Horry and Georgetown County. This is Jamie Lewis, and I found out that I had breast cancer at the age of 36. I was actually taking a shower. I had always done breast self-exams since I was probably about 16 years old. So I was familiar with my breast. I knew what was normal and what was abnormal. But this particular day, I was taking a shower, and it was my time of the month to do my breast self-exam. And I felt a lump in my left breast, just like Ty said, in the outer portion of my breast, there was a hard, small lump there. And I did panic when I found it. I was very afraid because I had always had fibrocystic breasts, but this lump did not feel like it was normal. So I called my OBGYN. She saw me immediately. She did her examination, and she said, well, I don't think that it's anything wrong, but just to be on the safe side, we're going to send you over to the hospital to have a mammogram and an ultrasound. So I left from her office and went to the hospital, had the mammogram and the ultrasound done, and was actually on my way back to work when she called me. I had not even gotten back to work yet, and asked me to turn around and come back and go directly to the surgeon's office. And I was really afraid at that point. So I went to the surgeon. He had the films already. He had already reviewed them. And he decided that he wanted to do a biopsy the next day, which is where they go in with a needle and take the tissue out of the breast to examine under a microscope. This was on a Friday, and I had to wait until Monday to go back in and get my results. I don't think that I was able to sleep the entire weekend or eat because I was so nervous. But when I did go back into the doctor's office on Monday, I heard when he came to the door and he took my chart off the door, and he just stood there for a little while. He didn't come in. And it was almost as if at that moment I knew that the news was not going to be good because he stood there for so long.
Okay, Ms. Lewis, I have 2 questions. One, how long did it take you to tell your kids that you were diagnosed with breast cancer? And 2, how did they take it once you told them?
I think it was probably maybe about a week later, I told my kids that I had been diagnosed. And They took it pretty well, surprisingly. They didn't cry. I don't know if they were afraid and just didn't say anything,
Right.
but they seemed to take it pretty well.
Like, I know it's important of how your family felt, but how did you feel once you realized that, this situation was real, like that you had breast cancer?
Initially, I was very, very afraid because I didn't know if it was going to be something that I was going to die from, or I didn't know the effect of the treatment. I didn't know the extent of the level of pain that I would experience after my surgery. It was just a lot of unknown things at the time, and I finally had to pull myself together because life was still going on.
Right, that's right.
I still had to be a mother. I still had to go grocery shopping. I still had to cook. I still had to wash clothes. I still had to do everything as if I hadn't been diagnosed.
Right, right.
So I think initially, once you accept the diagnosis, once you accept it, it's easier to pull yourself together and move forward.
Okay, my question for you is how long did it take you to accept it, and what did this experience show you about yourself?
It took me maybe about 2 weeks to accept the fact that I had been diagnosed with breast cancer. No woman wants to hear that she has breast cancer because we have, there's a common misconception about breast cancer and death. You think cancer, you think death, and no one wants to hear that. So it took me maybe about 2 weeks to accept the fact that I had been diagnosed. But once I did accept the diagnosis, I went through surgery. I had chemotherapy for 6 months, and I had radiation for 6 weeks. And I can honestly say that I definitely did not realize how strong I was. I didn't think that I would be able to handle the treatments and the surgery or the radiation the way that I did. And I have to say that it's definitely because of my faith.
Right.
Only because of my faith that I was able to endure it the way that I did.
Okay. Well, my question is, not sure if there's like symptoms besides the breast lump for breast cancer. Like, how you get diagnosed with something, you can tell by like if you get sick for this amount of time. But like, did you have any other kinds of symptoms besides the breast lump?
The only symptom that I can remember is there was a little bit of pain in my breast, and the doctor actually said, well, it probably isn't breast cancer because normally breast cancer doesn't hurt. So that's why she was convinced that it was really nothing to it, but she wanted to be on the safe side. But I did have pain in my breast as well as the lump.
Wow.
So what would you say to other women to give them encouragement for like what they when they get diagnosed with breast cancer, or they have it for a minute and they don't know what to do?
I would definitely say it is not a death sentence. I thank God for the women that He sent into my life when I was initially diagnosed who had survived breast cancer. And the first thing that every woman told me was, don't be scared. So the fear is probably the greatest enemy that you'll have to conquer if you are diagnosed with breast cancer. But it's nothing to be intimidated by. Like Nurse Ty said, there are treatments available now that weren't available 25 years ago. And the Lord told me to, as I'm going through this, don't look pitiful and don't look sad. Every morning that you get up, put your makeup on, tighten up your wig, because my hair was bald.
That's right.
And dress yourself up. Don't walk around and look and have a pity party. So that's the one thing that I did do. And I spent a lot of time in prayer, and I spent a lot of time in the Word of God. That was the only thing that allowed me to make it through like I did.
So you would say that you really got your strength. Your faith came into play.
Oh, most definitely.
No, was your faith as strong before you got diagnosed? Let's talk about that.
It was not.
Okay.
This was, sometimes I feel bad saying this to people, but this probably was one of the best things that ever happened to me, to be diagnosed with breast cancer, because a lot of times we look at it from the negative aspect, but we have to think that God always does things with a purpose in mind. And if we can take our eyes off of the situation and look at what God is doing behind the scenes. A lot of times God will use breast cancer to bring families closer together. A lot of times God will use breast cancer to strengthen a bond between a husband and a wife. A lot of times God will use breast cancer or any type of cancer to strengthen our relationships with Him. There's always a purpose, and I think that if we look behind the affliction at the purpose, then it makes it bearable.
And I was actually in a setting where you talked about the fact that you were going through some other things in your life.
Yes.
And having gone through the treatment and having gone through everything you went with breast cancer, you was actually delivered from some of the other things.
Absolutely. Most definitely. Like I said, I spent a lot of time in prayer, and spending time in prayer, God was able to heal within me a lot of other emotional problems that I had been experiencing throughout my life just by spending time in His presence.
Wow.
So I think that for me, it was actually something that was used to deal with other issues.
Okay. And Ty, I'm coming to you now. Would you say that that's probably common, what Jamie is saying in terms of women, how the people say if the world gives you lemon, they make lemonade?
I have heard from many survivors tell me that one of the best things that ever happened to them in their life is that they were diagnosed with cancer. And I'm not a cancer survivor, but I can truly look to that and understand how people would feel that way. Cancer doesn't have to be something that people look at and automatically think about death, but it is really something that can be celebrated, and we celebrate the survivors. So we celebrate the Jamies of the world. We celebrate the other survivors of the world of all the cancers, because cancer is no longer a death sentence anymore. It can be something that is survived if caught early.
And that's the key, if caught early. So, I know we'll probably run out of time in this segment, Jamie, but I can't say enough. What do you say to women? And what we want you to talk about in the third segment is the importance of women understanding getting that mammogram, doing the self-examination. I mean, because that could be the difference between knowing and not knowing. And I think Ty said in first segment, early detection is 95% survival rate. So that's what we want to talk about when we come back. Again, Horry and Georgetown counties, you're listening to Sound Off. Our very special guest, Ty Grissett, RN, and also the rep for the Horry County Susan G. Komen Foundation. And we celebrate our breast cancer survivor, Jamie Lewis. Y'all give it up. Stay tuned, Horry and Georgetown counties. We'll be right back. Sound Off.